Hello, here's Nicholas Tetro in Montreal, Quebec, Canada. My son Arthur Tetro drowned October 8th and we were able to save his life. Notwithstanding a lot of shortcomings from the Montreal Children's Hospital, where we send our son to the US to be treated in hyperbaric medicine, and by an amazing team at Ochsner Hospital in New Orleans. So this week in Hamilton, Ontario, a young boy drowned, and the hospital called McMaster Pediatric Intensive Care Unit, McMaster Children's Hospital, showed partial ignorance that made a crucial difference, made a crucial difference because the little boy died at the age of 20 months. Jacob Victory, whose mom is from Quebec and the dad from Ontario, died where they could have saved his life. What we did, we put them in contact with two of the best doctors, one in Canada specialized in hyperbaric medicine, and Paul G. Harsh in Louisiana, was world famous, and even the French-Canadian doctor was world famous in cerebral palsy and drowning accidents. We explained something very simple, and I don't know how you can be in charge of a pediatric intensive care unit at a prestigious hospital like McMaster Children's Hospital, and the same applies to the head of the pediatric intensive care unit at the Montreal Children's Hospital. How can they show such partial ignorance that is life-changing, that is a lifesaver? You know, when someone drowns, they have post-drowning brain inflammation. The only way to reduce it, it's not by medication. It's simple. Hyperbaric chamber. If you don't have a hard shell one, the 1.3 low pressure, 1.3 ATA soft shell hyperbaric chamber will reduce the brain inflammation. And in the machines, you can bring a ventilator, you can bring a suctioner, you can bring a defibrillator, and you can be even one or two doctors in the machines at a cost of what? $40,000 to $60,000 Canadian, 70,000. You're telling me that the pediatric intensive care unit of both these hospitals cannot afford it? Worse, we spoke with the head of that intensive care unit, who was completely unaware of the existence of hyperbaric chambers, like the one in Montreal. Sam Shimmy, in charge, supposedly world neurologist, has no clue whatsoever that hyperbaric chambers can reduce brain inflammation following a drowning. But tell me, if they did not teach you this in Canada at our universities because we have limited budget, tell me how the hell you cannot know that when you just Google it and look around the world. And if you take ChatGPT, the same version as I use in the American hospitals, you have tens of studies, a dozen studies by scientific and doctors around the world explaining clearly that post-drowning brain inflammation can be reversed with low pressure, soft shell hyperbaric chamber that anybody and everybody should have. How ignorant can you be in 2025? This boy died for no freaking reason. You could have done it. We've put that hospital online with the world's most famous doctor, and they still didn't do it. Like us in Montreal, they refuse the knowledge. But that's the legal problem, because once we present you with the knowledge and the evidence and all the links, we gave him, imagine that, even everything done for him on a red carpet at the McMaster Pediatric Intensive Care Unit. We gave him all the links to all the medical studies in the world, but they refused by choice. They ignored it by choice, even though when they're presented the information black and white in front of them. This is what caused the death, the unnecessary death of that child. Shame on you. And it's about time that Canada wakes the hell up our medicine becomes modern medicine. This is enough of the ignorance. How ignorant can you be in 2025 when non-doctors like me, when parents find the cures or partial cures and save the lives of their children? What are they teaching our supposed specialists in hospitals? Enough is enough. It's very simple. Any pediatric intensive care unit, contact me in Canada. I'll put you for free in direct relation with the world's most advanced doctors in drownings and cerebral palsy. I'll send you the links to all the studies, and I can even give you the mobile numbers of these medical researchers at universities and professors of medicine. There is no excuse in 2025 not to know such simple fact that post-drowning brain inflammation, the cure and the only cure is hyperbaric chamber, soft shell or hard shell. And if your patient is intubated, doesn't matter, you put him in the soft shell ones, the commercial grade. They're large enough to bring all your machines with you and the RT and the doctor in the machine, and you'll be able to save hundreds of lives in a decade. It's the least that we can do. And if the hospitals can't afford a $70,000 soft shell hyperbaric chamber in their intensive care unit, well, I'll help you raise the funds on top of this. This is unacceptable. Nicholas Tetro, I'm 50 years old. We saved the life of our child Arthur, who's doing ever better every day, thank God. I was advisor to the Premier of Quebec around 4 elections, and I'm no dummy. So if you need help, we will provide you help. But stop the ignorance, because your people are dying that should not be dying. This is completely ridiculous that you don't know this. It's ridiculous and unacceptable. You portray yourself as one of the best hospitals, but you're dinosaurs. You're dinosaurs, and it's the blind leading the blind. Unacceptable. And you're paid with the money of our hard-earned tax dollars. Unacceptable. Shame on you, McMaster Pediatric Intensive Care Unit, and shame on you, Pediatric Intensive Care Unit of the Montreal Children. Shame on you. Real dinosaurs in some aspects.